Hello everyone. Here we are going to discuss the important topic that is Leukemoid reaction. In your university exam, you get short or very short question on that, and especially very frequently the question is asked how to differentiate Leukemoid reaction from CML. So it is the differential diagnosis of CML. So that's why it's very important and we will see it in detail. So let's start the topic here. You can see we are starting the topic Leukemoid reaction. So first of all, I will let you know the definition, the introduction of Leukemoid reaction. What is Leukemoid reaction? Then we will see the two types of Leukemoid reaction, the myeloid and lymphoid. For each of them, you should learn the causes, their lab findings and their differential diagnosis. So let's start it. Before starting the Leukemoid reaction, let me give you an overview of the WBCs. In human blood, in hematology, in human blood, there are three types of blood cells present in human blood: RBCs, WBCs and platelets. RBCs are known as erythrocytes, WBCs are known as leukocytes, and platelets are known as thrombocytes. I guess everyone knows that the three basic cells. Currently, I am interested in WBC. How many types of WBCs are there? There are two types of WBCs. Depending, their cytoplasm have granules or their cytoplasm don't have granules. If the cytoplasm have granules are present in the cytoplasm, it is known as granulocytes. And if the cytoplasm don't have the granules are absent in the cytoplasm, they are known as agranulocytes. A for absent. The granulocytes are absent. The granulocytes are of three type and agranulocytes are of two types. So total 5 type of WBCs are in front of you. The three type of granulocytes are neutrophil, eosinophil and basophil. Neutrophil have pink or violet granules. Eosinophil have red granules and basophil have blue granules. They have the granules, but the color of granules is different. They have the granules in the cytoplasm, but color of granules is different. Agranulocytes don't have granules. You can see the lymphocyte and monocyte. So these are the 5 type of WBCs. You can see the same here. The 5 type of WBCs appreciate. You can see neutrophil. I want you to appreciate the pink or purple granules. You can see the eosinophil, appreciate the brick red color granules, appreciate the basophil that is having blue granules. So these three are granulocytes. They have the granules in their cytoplasm. But lymphocyte and monocyte appreciate them. They don't have the granules. So these are the 5 type of WBCs. Now where does they all synthesize? They all are synthesized in the bone marrow. The precursor cell which give rise to them is hematopoietic stem cell. Hematopoietic stem cell give rise to RBC, WBC as well as platelet. It gives rise to RBC as well as WBC as well as platelet. So the precursor of all the cells is hematopoietic stem cell. Once these cells are formed, they come in the peripheral blood. Now how does this synthesized in the hematopoietic stem cell? So from the hematopoietic stem cell, you can see two type of cells. The two type of stem cells are arising: the myeloid stem cell and the lymphoid stem cell. The myeloid stem cell give rise to RBCs also. It give rise to platelet also. And among the WBC, there are 5 type of WBC I told you. 4 of them are formed from the myeloid series only. Which 4? Neutrophil, eosinophil, basophil and monocyte, but not the lymphocyte. And from the lymphoid stem cell, only one cell is formed, that is lymphocyte. So this is, I hope you got it. That's why myeloid is known as trilineage, because it gives rise to RBCs also, platelet also, and among the 5 WBC, 4 of them. 4 of them are synthesized from myeloid series. It is known as trilineage. Same thing is shown to you here also. So here also you can see this is hematopoietic stem cell. The hematopoietic stem cell give rise to 2 stem cell, myeloid stem cell, lymphoid stem cell. Myeloid stem cell give rise to RBCs, give rise to platelet, and among the WBC, 4 type of WBC. That is neutrophil, eosinophil, basophil, and monocyte. The 5th WBC, that is lymphocyte, is derived from the lymphoid stem cell. So the same thing is given to you. Now what is the normal count of WBC in human blood? So total WBC count, that is known as total leukocyte count, TLC. It is 4,000 to 11,000 per mm cube. So 4,000 to 11,000 per microliter or per mm cube is present in human blood. This is normal count. And you can see the differential count, differential leukocyte count, each of the 5 WBC, what is their normal count? What is the percentage they hold in the total one? So this is what you have to learn. Now let's start the topic Leukemoid reaction. If you got this, you can understand what is Leukemoid reaction. In Leukemoid reaction, the total WBC count is very high. Maybe normal, I told you it is 4,000 to 11,000. In Leukemoid reaction, it is more than 25,000. More than 25,000, but less than 1 lakh. So 25,000 to 1 lakh it is. So in leukemias also WBC count is very high. So we always get confusion between the Leukemoid reaction versus leukemia. So we have to differentiate it. What is Leukemoid reaction? It is leukocytosis. What do you mean by leukocytosis? Leuko means WBC, and cytosis means increase. So the WBC increase in blood. So that is, split the term, you will get the meaning. Leuko means WBC, cytosis means increase in number. So leukocytosis means WBC increase in number. So what is the normal range of WBC? I told you 4,000 to 11,000. So instead of 4,000 to 11,000, WBC are 25,000 to 1 lakh per mm cube. So this is, they increase in their